Welcome to Kids Considered, where two pediatricians discuss children's health topics of interest to parents in a podcast with new subjects considered every episode. I'm Dr. Lena Vanderlist.
And I'm Dr. Dean Blumberg.
And we're both pediatricians at UC Davis Children's Hospital in Sacramento, California. So fluoride has been in the news a lot lately, and I think it might be a good time to talk about why it's in our drinking water, toothpaste, other products, and really why it's important for children's teeth and health overall.
Mm-hmm. And then we should also discuss if it is safe or not, because there's been some talk that it should be removed from drinking water. And there's been some recent news reports that fluoride in water causes low IQ.
Yeah, I know. And this is now more common than ever that parents will bring up this concern or want to talk about it. But it just really isn't true.
Mm-hmm. So let's talk about where this concern came up in more detail later. But let's start with why fluoride is important for children.
Yeah, great idea. So the short answer is that fluoride can make our teeth stronger and prevent tooth decay.
And we all want children to have healthy teeth, right?
Right. I mean, including the child. They may not know it in the moment when they're asking for that fifth candy cane, like at our house. But
Right.
I think that they want healthy teeth when they're older.
Right. And most people don't realize that tooth decay is a huge problem.
Yeah, tooth decay results in cavities, also known as dental caries, and it's really the most common chronic disease of early childhood. So children with tooth decay lose millions of school hours every year, and of course, that can be associated with pain and financial costs.
Tooth decay disproportionately affects those who are poor, those who are Hispanic or Black, and this results in health inequities.
So before we go into talking about how fluoride works, let's first talk about how cavities themselves develop. So we all have bacteria in our mouths, that's normal, and this bacteria can combine with sugars from drinks, food, and produce acid. And when that acid is produced, it eats through the outer layer of the tooth. That's the enamel, and then the cavity may develop.
Mm-hmm. So we know that fluoride is a natural mineral, so it's naturally in water. How does it slow or stop cavities from developing?
Yeah, so fluoride actually protects the teeth in the presence of acid so that teeth are less likely to be damaged. And it actually helps rebuild the tooth enamel to provide protection against cavities in the future.
So it makes for stronger teeth. And that's why fluoride is included in most toothpastes. And that's why many communities add fluoride to tap water, because the tap water may be low in fluoride. So they want to make sure there's enough fluoride in there so that children get enough to protect their teeth.
Yeah, so it's been added to many community water supplies for over 75 years here in the United States, and it has resulted in healthier teeth, really. So it's reduced tooth decay by 25%.
So 25%, that's a significant reduction in cavity formation.
Absolutely. We should talk about also kids who live in communities where the tap water may not have fluoride in it. So here where we practice in Sacramento, most are, but there are two little, suburb areas that I know, at least for my, in my own practice, I have to supplement. So how do we make sure kids in those areas that may not have it are getting enough fluoride?
Mm-hmm. So yeah, as we mentioned, fluoride is naturally occurring. So there's going to be some in the water, but there may not be enough. So in areas where the water isn't supplemented with fluoride, then we can give them supplemental fluoride.
Most of the time that will be like these little tablets that you can mix in with their water. Occasionally, like a dentist may prescribe a higher concentration of fluoride in their toothpaste. And, it's not one of those things that might be on your Zillow listing when you buy your house.
Right.
So you may want to go check. The CDC has a website, My Water's Fluoride, and we will have that linked. So you can put in your address and see if your community has fluoride in the water.
Yeah. So that link is on our website.
Most people don't realize that almost all water, like you mentioned, contains some naturally occurring fluoride.
Right, but most of the time the amount is too low to prevent cavities. And so that's why fluoride is added, and it's added in very small quantities.
Very, very small. So the concentration of fluoride is equivalent to about 3 drops of water in a 55-gallon barrel.
So that's not very much. It's a pretty low concentration.
Absolutely. But some parents, of course, are concerned that it would be possible for a child to get exposed to too much fluoride. Is this possible? And what side effects would we see?
Yeah, so we don't want to overdo it. We don't want to have kids get too much fluoride because too much fluoride before 8 years of age can cause dental fluorosis. And this changes the look of the teeth that usually results in these faint white markings on the teeth.
Is it painful or is it making the teeth weaker?
It doesn't hurt and the teeth function normally, but it may be cosmetically noticeable.
So we need to make sure that children don't get too much fluoride. I always talk to my patients about this. I'm like, even good things, like too much of good things is not great, right? Like, so you can overdo it with like iron or vitamin D or any of these things that we typically think about as being good. You need to be, conscious about it. But so you don't want to overdo it, but you want to make sure that it's there. And we know that in the amounts that we have in the United States in fluoridated water, a typical diet using fluoride-containing toothpaste, which is recommended for all children once they start brushing their teeth, if we use it at those recommended concentrations, you're not going to get fluorosis and you're not going to get any other side effects.
So what are the recommendations to prevent too much fluoride?
Yeah, so the right amount of toothpaste is a smear for children less than 3 and a pea-sized amount for children over 3.
So a pea-sized blob, I understand that because I know what peas are, right? But what's a smear? I'm thinking like smearing cream cheese on a bagel.
That's too much.
Right.
No, it's like a grain of rice amount or less. Like, because those kids, even at 3 at our house, like it's hard for her not to swallow the toothpaste, which is not harmful when you're using this amount, but, not ideal. You want, as they get older, for them to spit out the toothpaste. But like a grain of rice is a totally safe amount for them to swallow because that's what you're expecting at this age.
Yeah, so that makes sense.
We recommend that children brush their teeth twice a day and spit out the toothpaste, like I mentioned, once they're able, definitely over 3, 2 and 3, trying to encourage that skill.
Yeah, even if they can't do it, it's always good to remind them, right? So eventually they'll figure that out. Any other concerns about fluoride?
Yeah, so I think that the biggest one recently were some news stories and different studies that suggested that fluoride affected IQ.
Right. So let's break this down. This was in the news last summer, the summer of 2024. And there were some studies that suggested a possible link between lower IQ scores for children and very high fluoride levels in drinking water.
Yeah. So, of course, that would be alarming if it were true. But it really doesn't make much sense. So we know that there's no obvious mechanism for this to occur. And when we looked closely at the studies, the fluoride was really, really high, like over 3 times the concentration that we have here in the United States. And they were all done in non-US countries in exposed pregnant women and children, like I said, that had at least 2 times to 3 times more concentration of fluoride in their drinking water than we have here in the US.
Also, the study populations were very different, and we know that there are many other factors that can affect IQ.
Right, of course, genetics, cultural differences, other environmental exposures, nutritional access, and many, many other factors.
We don't even know if it's biologically plausible for fluoride in water to affect IQ, and the studies were not designed to demonstrate cause and effect.
Several studies that were not mentioned found no link between IQ and fluoride levels.
So overall, this was just unreliable news.
Yeah, so since we're on the subject of fluoride, let's talk about fluoride varnish that can sometimes be applied.
Good idea. So fluoride varnish is applied directly to the teeth by a dentist or pediatrician after the first tooth appears. It hardens quickly, then it's brushed off by the parents at home 4 to 12 hours later.
And this will help slow down and prevent tooth decay like we mentioned with regular fluoride in the water.
And that leads to healthier teeth.
It's usually applied maybe 2 to 4 times a year until the child's about 5 years old.
So will this fluoride varnish lead to too much fluoride exposure?
No, it's safe and a very small amount is used and hardly any of it is swallowed.
Okay, so let's talk about some special situations like fluoride for infants on formula or breastfeeding.
Yeah, so really children less than 6 months old don't usually need any extra fluoride because they don't have any teeth, to state the obvious. Although some 6 months olds do have teeth. But for children, it's safe to use non-fluoridated water when mixing formula.
And because of the small risk of fluorosis, parents may choose not to use fluoridated water to mix formula until the first tooth appears, and instead use purified or bottled water without fluoride to mix formula, or use ready-to-feed formula already mixed.
Remember, bottled water is not required to list the amount of fluoride unless the label has some claim about it.
So sometimes you just don't know the fluoride content of bottled water unless it's explicitly stated.
So let's get to the bottom line of the episode. Is fluoride in drinking water safe for kids, and is it helpful at preventing tooth decay?
Yes. Our professional organization, the American Academy of Pediatrics, along with the American Dental Association and the Centers for Disease Control and Prevention in the U.S., all agree that fluoride in drinking water is safe, it's effective, and it prevents tooth decay.
In fact, the Center for Disease Control and Prevention in the U.S. named fluoridation in drinking water one of the 10 great public health interventions of the 20th century because of the dramatic decline in cavities since community water fluorination started in 1945. Pretty impressive.
We hope that this episode has demystified some of the public discourse about fluoride in water.
But if you have any questions or concerns, please check out our website. We'll have a lot more links to reliable information. And of course, you can always ask your doctor or your dentist.
And of course, that reminds me of a fluoride-related joke.
Okay, let's hear it.
What kind of tree does toothpaste grow on?
What kind of tree?
Toilet trees. Kind of. I don't know.
It's a reach. It's a reach. But it is a similar kind of concept.
In your practice, do you apply fluoride varnish?
I think most listeners know that I work at 2 different clinic sites. I work at more like a private practice type clinic, and then a federally qualified health center that takes care of a lot of lower income or kids on public insurance. And so working for a federally qualified health center, it is, I think, a requirement that we do apply it.
Oh, really?
We do apply fluoride varnish at one of my clinics, and at the other one, we do not. But I will also say that at my private practice clinic, most of my patients are established with a dentist by the time they're 15 months, and they're seeing them every 6 months. So, it's one of those things like we highlighted in the episode that unfortunately, dental care in the United States and much of the world is really harder to access for people of low-income backgrounds. And so, the water supply has really made probably the most dramatic change in helping prevent dental caries and dental issues for these lower-income people, right, who have harder time accessing care, that we're probably spending more money out of pocket to get those things corrected, or having more dental abscesses or dental infections as the result of not being able to access care. So another one of the health disparities in the United States.
Right. And then they're missing more school too. And then that's going to affect their academic achievement and future economic prospects too.
Absolutely. So just another thing that has been so easy to do as on a community level that can help some of our, lower income families.
That wraps up this episode of Kids Considered.
You can find more information on our website, kidsconsidered.ucdavis.edu.
Follow us on Twitter @KidsConsidered.
And Instagram @KidsConsidered.
If you have feedback on this show or topics you would like us to discuss in the future, we would love to hear from you.
Please call us. Our number is 916-915-3388.
Or email us at kidsconsidered@gmail.com.
Please rate us on iTunes or wherever you subscribe to your podcasts.
Thank you for listening, and we hope you will join us for our next podcast.
Kids Considered is sponsored by UC Davis Children's Hospital.